this is the second operation of a nose job, and this is how I was left. What they did is they actually brought it up a little bit, and what they've said to me is to correct it, I should have filler. But that was 7 years ago, and filler 7 years ago wasn't that in the market, so I was a bit nervous. But now, I've heard about Adam so many times now that I've taken the risk to put myself in his hands. At Nutfield Hospital in London.
So, because obviously it's not right, is it?
No, it's not right.
No,
it's definitely not right. So I've come and seen Adam and we've... Well, actually, I went to see a beauty lady and she said, we can do an injection, but I don't know where the blood vessels are, and then we'll do an ultrasound. And I said, stop. We'll do the ultrasound first, and that's how I've ended up with Adam. Adam did the ultrasound and actually said that the veins in my nose, there's many missing to a normal person who hasn't had an operation.
Not necessarily the veins, but the arteries.
The artery,
yeah,
that's it.
Because what they do during surgery, they quite often tie some off and they don't put them back. So, yeah, when we did her ultrasound, you can clearly see there's not the same vascularity that there would be normally. When you first start out with nose filler, you know, as I tell my students at that level, you stay away from people who have had nose surgery, you stay away from people who have had broken noses because of the change in anatomy. However, the reason that we're going to do this is because of the methodology that I'm going to use, and I'm confident that we will be absolutely fine using that methodology. Obviously we've ultrasounded it first, so I've got a rough idea of what's going on, but that is not the be all and end all. You can misread that quite easily. The most important thing is the methodology that we're going to use to keep her as safe as possible, and that's what I'm going to go through with you guys step by step, is all of the different things in just one injection that we're going to do to keep her as safe as possible. Bear in mind we have got this complex situation, and even more so, it's not simple either. There's a lot to do.